Good afternoon, everyone. Happy to see you back here on Monday afternoon. A little bit of a gray day here downtown. We're going to talk with you about COVID today, of course, and we're also going to talk about a couple of Thanksgiving, a couple of things over the weekend, and of course, we're going to take your questions. So, beginning with COVID. Yesterday, the city reported 181 cases. People in the hospital, and this is region-wide, there were a total of 961 people, 830 COVID positive, 131 suspected of being positive. That's down a little bit, but still that number is way too high. Our hospitals are really being very stretched, and primarily because they just don't have the people, the doctors, the nurses, the other folks to take care of you when you're there. So we are continuing to remind everyone to keep their circle small. Don't go places you don't need to go. We'll talk about Thanksgiving here in a few minutes. ICU, there are 181 people, both COVID positive and suspected, in the ICU. Just to give you a little perspective, on November 1st, that number was, sorry, hang on one sec. On November 1st, that number was 125. So we've gone up from 125 to 181 just in the last 22 days. People on ventilators right now at 95, and back on November the 1st, it was at 64. So a third more people in using ventilators. People admitted to the hospital, last few days it's been 134, 135 people a day. And you know these hospital numbers lag 2 days behind. Our average, well, that's not the average, that's 7-day average is 134 people admitted to the hospital. But yesterday, 2 days before, it was 101, but it's been as high as 152, and that was the day before that. So very serious numbers, people seriously ill going into the hospitals, really taking up hospital capacity for normal things. Many elective surgeries have been canceled or postponed, and some people have elected themselves to postpone it because they don't want to be in the hospital during this time when staffing is short. Other people, the hospitals have said, hey, you need to postpone. So all that making room for COVID patients in the area. A lot of people being tested right now. Last week we saw a lot of people being tested. This week I've heard anecdotally of people being tested. That's stretching the laboratories a bit. It's now taking on average about 4.5 days to get the results back from the PCR tests. And so that is normal, I guess, when you've got the holidays coming up. You have a lot of schools testing folks, universities, colleges and universities. So that is, that's stretching the labs a bit. When you look at let me find this. City of St. Louis numbers are still considerably better than, what did I do with this? Here it is, sorry. Considerably better per capita, per 100,000 people than other areas. Our average number, 7-day average number of new cases per capita in the city today is at about 46 people. And if you look in St. Charles, it's at 101 people per 100,000 people. Jefferson County's at 96, St. Louis County's at about 78. So that's good relatively, but we all still have to be extremely cautious and careful in order to try to bend this curve down, because this is not sustainable, what we're doing now, particularly with regard to the number of folks in the hospital. So that's COVID for right now. A couple of other things. We are still, of course, working on rental and mortgage assistance. There have been 1,300 units that have been paid for during this time, and many more still being worked. Many more applications still being worked by our partners who are working hard on that. As you know, we had a new round of grants, $5,000 grants for small businesses, and we were going to, it was $1,250,000, $1.25 million. That will pay about $255,000 grants. And so we're working through those. We got many more applications than we have money for. But we do expect to work through those applications this week and next week to where we should be able to actually cut some checks next week. We are looking at these on a first come, first served basis. We are also giving priority to folks in the hospitality industry. So whether that's a restaurant, maybe a wedding planner, someone who's been really very seriously impacted. So we'll have more to say about that next week. Probably in the middle of next week we should know a lot more about that. And a couple things on the good news front. Steinberg skating rink. You all know where Steinberg is in Forest Park. This weekend it was announced that they've been ranked, this was in USA Today, they've been ranked in the top 20 skating rinks in the whole country. So we're proud of Steinberg. Annie Castle runs Steinberg, has done a really great job. So, you know, we've got a little holiday weekend coming up here. You'd be outdoors. They are limiting capacity, but you'd be outdoors. That would be a good thing. Go get a little exercise and remember about going to Steinberg. They do a great job there. So we're proud of them for being in the top 20 in the country. I mean, that's kind of a big deal. And then the last thing I'm going to say, well, I guess two more things. This coming Saturday, as you know, is Small Business Saturday. So, you know, our small businesses, sometimes they're called Main Street businesses, have been hit harder than any other businesses in terms of reduced sales during this pandemic. We're going on 9 months of being in this pandemic in the St. Louis area, even longer in some other areas of our country. But small businesses have been very severely impacted. So as you're thinking about your holiday shopping or thinking about some things that you might need, really consider shopping a small business. They have websites too. They have curbside pickup. They've got good ways you can order online. You can have it shipped to you. It's not just the big retailers that have that. So let's not forget to support St. Louis's small businesses. Not just this Saturday, but this Saturday kicks it off. But during this entire season, because if enough of us remember that, it'll make the difference between them being here next year when you want to shop there and not being here. So Small Business Saturday, this Saturday. Make it count. And then the last thing I'm going to talk about for a minute is Thanksgiving. I bought my turkey this weekend. It's way too big for the 5 people that I'm going to have at my house. So I guess there'll be leftovers for a while. Everyone, by the time I'm done making it into all kinds of different things over a couple of weeks, nobody in my family will want to be see a turkey for a while. But we do have to keep these gatherings small. This is hard on all of us. We want to go and see our families. We want to get together. We want to be in these, but it really is not safe to do so. We know that COVID is spreading in family groups, neighbor groups, small groups of people is where it appears to be spreading the most. So, we all just have to knuckle down this year. Keep your group really small. Ideally within your same household, but if not just your same household, your household and maybe one other's. A few people is great. And when we're through this, when we will be through it, but when we're through it, then we can all get together again with our whole extended families, which is, of course, what we're all very anxious to do. There's some positive, good news on the horizon. This morning, it looks like there are 3 potential vaccines that may be coming to market. I'm actually going this afternoon, about 5 o'clock, I think it is, to see one of the labs at St. Louis University where they actually are running some of the trials, the clinical trials. I'm anxious to see that and really to thank the scientists, the doctors, the folks who volunteer for these trials. Of course, it's going to be fewer than 10 people. It's going to be socially distanced, and we're all going to be wearing masks. But I'm anxious to go see that this afternoon. But we do have some good news on the horizon with regard to vaccines, but we're not there yet. And so, looking forward, looking a little over the hill here, next spring, summer, hopefully we will all be able to get back together with our extended families. So, thank you all for that. We can certainly take your questions now. Let me ask my technical people. I've got an error popping up here. Looks good from there? Okay, well, we'll ignore this. It's telling me, sorry, we're having trouble playing this video. So hopefully you're still with us. Now, we'll take your questions. Jacob?
Christine has a question about testing, Mayor. Is the city going to have enough testing to sustain the increase in cases? And are we working on expanding the availability of testing in the city?
Christine, we do have enough testing to get us through this next time period. And we have a lot of testing sites right now, probably at least 15 that are through our federally qualified health centers. But also, as most everybody knows, urgent care facilities are doing testing. Walgreens, CVS, they're doing testing. So there is a lot of testing. You do have to wait in line sometimes, but we think there's adequate number of testing sites at this point.
Rachel has a question about a stay-at-home order. The region implemented one in the spring. Can you talk about why the region hasn't done it this time and what makes this time around different?
Well, the stay-at-home order, of course, shut everyone down for 8 weeks, I believe it was, in the spring. And that was effective for the period of time that everyone was shut down. But what we know is that during that period of time, we were on a very steep slope. We're on a very steep slope again, but we also know that we have to take a balanced approach. Now we know that the spread is happening at home, neighbor groups, friend groups, not so much in offices, in workplaces, because over that time period before people came back, there were many modifications made in workplaces. We also implemented a mandatory mask mandate. So what we think is just a different situation now. We've put in a lot of modifications, and we think that at this point in time, there's a balanced approach here. There's also a real crisis for people that are put out of work, people whose hours are reduced. We're seeing a big increase in violence, a big increase in domestic violence. We're seeing a big increase in opioid overdoses. And so we're trying to take a balanced approach here. And we think with the mitigation factors that we've got in place now, if we can just get people to stay in their small groups or to just go out when you need to go out, we think we can tamp this spread down again without closing down the whole city.
Jarika submitted a question about the vaccines, Mayor. Do you foresee a scenario in the city where vaccines are going to be mandatory for people to take them?
That decision is going to be made by the healthcare professionals, but it seems unlikely that it would be mandatory, but certainly trying to persuade people to take the vaccine. So, healthcare workers will be taking it first, most likely. First responders, people that have underlying health conditions that are our most vulnerable. And that's why, I mean, we're actually expecting to see some doses of the vaccine come out around the end of the year. These vaccines are all 2-dose vaccines, so you have to get one, and then 30 days later you have to get another vaccine. And so we are expecting that will get those first responders and most vulnerable people first, and by the time it gets out to the general population, that we might be looking at April, May, June. So
Jordan is watching and has a question, Mayor, about the $1 billion in unspent federal aid at the state of Missouri. Do you have an update on that and what we can do to help get that funding released to the city and the places that need it?
So Jordan, I don't have an update on it because the state Senate was supposed to meet on that last week, or maybe it was the week before by now, but they all went on a retreat and didn't wear masks, and so now there's an outbreak in the Missouri State Senate, and they are now planning to come back in the week after Thanksgiving. So there's not an update at this point in time, but certainly we need additional funding through that CARES Act money.
A question, Mayor, to what you talked about earlier about people who are working from home. Is the city tracking how many jobs have moved to home versus an office space, and how many may or may not return to an office space?
So we are not tracking exactly how many people are working from home because, of course, we don't have that information. But we do know that many offices, professional offices, those who can work from home are working from home. And I think, we're looking at spring perhaps before many of those folks begin coming back into office space. There's a lot of speculation out there in the commercial real estate market about how many of those jobs will actually come back into offices. And so, because it's very important, of course, to commercial realtors, but there's also a whole move of people that really are anxious to get back to the office. While, working from home has been good, it was good for a while, but there's a lot of juggling going on in homes. Sometimes you've got 2 adults working from home, and you've got kids studying from home, and so that's been a challenge for people too. Many people are anxious to get back and see their coworkers in person versus Zoom.
Do you anticipate seeing field hospitals or the military, including the National Guard, being mobilized to help if our hospitals are completely overrun?
Maybe, yes. That's something that we're in conversations about right now. Primarily the problem is a staffing problem versus an actual location problem, but we are in conversations about that right now. And if we're very concerned about, frankly, this week and this weekend, because all of these Thanksgiving dinners that occur, or just people getting together with friends, we know that this is the biggest age group that is COVID positive is young people in their 20s. The second biggest age group is people in their 30s. And we know we're coming up on a weekend here where a lot of people want to be getting together with friends and family. And if we can't persuade people not to do that, we are likely by Christmas to be just even worse than it is today. So yes, we are looking at trying to perhaps have some federal or some state and federal staffing of our hospital beds.
Betty has a question, speaking of 20 and 30-year-olds, about bars and restaurants, Mayor. What do you anticipate those places being able to accomplish safely on New Year's Eve, if anything?
That's a good question, but I'll be honest with you, I haven't thought about New Year's Eve yet. That's a long ways off at this point. I think that it's very likely that we will still have an 11 p.m. closing in place on New Year's Eve, if that's really what the question is. Is that really the question? So I don't see big New Year's Eve parties in bars, restaurants, or ballrooms. I don't see that happening safely. Sorry to say that, but maybe that's one of those things I'll be wrong about, and happy that I'm wrong about it. But right now, I just tell it to you straight. I don't think that's happening.
So on some other topics, Mayor, about residency, which has been lifted for a couple of weeks already, has the city made any headway on hiring additional police, fire, EMS, or 911 dispatchers under residency rules?
So we are working on that continually. I don't know, do you know the numbers of how many people we've hired in the last 2 weeks? I don't know that number exactly. I do know that, for example, this is anecdotal, but we did bring 3 people back on to the police department who used to be here and left, but they wanted to come back. And so we did bring them on. That's just a snapshot. I don't have the actual number of people, but we are actively recruiting. I've seen it on my own Facebook feed and maybe Twitter as well, and Instagram. So, you know, anyone who is interested in being a police officer, please just go online, go to the city's website, and get in the process and apply, because it takes a little while to get through that process. There's a lot of screening that occurs. And then the police academy is about 6 months. It is paid, by the way. Some people don't know that. Those people who are in attending the police academy are paid during the time period that they're attending. And a lot of it now is virtual, but of course there's a lot of it that isn't. The classroom part of it is virtual, but you know, the training part, the physical parts of it that you have to be together is not virtual. So we're encouraging people, of course, police officers, particularly dispatchers, 911 folks and dispatchers. So go online and apply.
Last question that we have for today, Mayor, is could you please, regarding Thanksgiving, urge folks to explore alternatives like walks in our park, Zoom calls, or maybe regular old phone calls?
That's a really great way to end this. So yes, don't get together with that big extended family, as we've said, but maybe take a walk with them and wear a mask. Zoom calls, FaceTime, pick up the telephone and call one another so that you can be together in spirit, even if you can't be together physically. You know, our parks in the city of St. Louis have stayed open this entire time. We never closed our parks. And in fact, we closed a few roads in the big parks so that there would be more room for people to walk, socially distanced, and get out and you know, blow off a little steam and get some exercise. You know, I'll be honest with you, I'm planning to do that myself on Thanksgiving Day. I hope it's a nice day. I haven't seen the forecast yet. I think it looks like when I looked at it a day or two ago, it looks like it might be a decent day. So yeah, get out, get in our parks, take a walk, call your friends and relatives, talk to them on the phone. Thank you guys, appreciate you being here. We'll be back with you next week. Thanks.